This podcast is sponsored by PAX. Whether on water, on land or in the air, PAX bags are both versatile and flexible backpacks that are perfectly suitable for your requirements in the most demanding of environments. PAX bags are highly regarded due to their exceptional performance in pre-hospital and in critical care environments. Renowned for their durability, they endure harsh conditions while providing rapid and reliable access to essential kit. So their well-organised compartments and customisable configurations enhance efficiency in high-stress situations. PAX bags are designed with infection control in mind and are easy to clean and disinfect. Their highly visible colours and reflective strips add quick identification and adherence to quality standards, assuring reliability. The versatility of PAX bags caters to a diverse EMS providers, but also delivers vital equipment and durability and ease of use for pre-hospital critical care services globally. I've used PAX bags in a number of critical care situations and they're absolutely excellent. Please see the show notes for further details.
You're listening to the Prehospital Care podcast on the Medics Academy Network.
Welcome back to the podcast. In this episode, I'm speaking with Johannes Strobel about prehospital care in Germany. So in the episode, I really wanted to dig into what prehospital critical care and indeed prehospital care fundamentally looks like within Germany, but also just really dig into our guests' perspectives on how he's driving the field forward, both within clinical standards, also within policy and indeed intervention. So with extensive experience in prehospital medicine, Dr. Strobel has been at the forefront of innovation, pushing boundaries to deliver exceptional care in high-pressure situations and environments. So in the conversation, we're going to delve into his journey, explore some of the challenges and rewards of developing EMS systems in diverse settings, and some of his lessons learned along the way. So we're also going to discuss the integration of technology and education into prehospital care in Germany and examine how some of the cutting-edge innovations are shaping the future of the field. We're also going to look at AI, telemedicine, and indeed the evolving role of simulation training. So we're going to get Johannes's perspective on the trends that will define prehospital critical care for the years to come within Germany. This episode provides invaluable insights into really the future and different perspectives of prehospital care from a European perspective. Welcome to the podcast, Johannes.
Thanks for inviting me. Really happy to be here.
I wonder if we just start with getting your really just your fundamental journey into prehospital critical care and what inspired you to specialize in the field.
So the thing is, I started off as a paramedic right after school, and after being a paramedic, I started medical school and worked as a doctor in hospital after medical school. And initially, I wanted to come back to the pre-hospital care medicine, but right when I started off in hospital, I fell in love with intensive care, and I did quite a long time in intensive care. But I had one doctor, and she was some sort of a mentor, and she said, like, don't have a too narrow focus and go broader, look at other things. And I then came back to pre-hospital critical care, and I started off as a critical care physician and worked pre-hospital in Germany. And that's my journey. So from being a paramedic by hospital work to being in the pre-hospital setting again, and now working operational in EMS services. So that's a rough idea.
Could I get you to speak to some of your most, I guess, pivotal moments within pre-hospital care? Because like you said, it's been quite a circular career for you. You really returned to pre-hospital care. Could I get you to speak to sort of some of the, I guess, pivotal moments or cases? True to say, pre-hospital care can be some of the most challenging of environments to practice medicine, just because of the dynamic environment, dynamic patient population, presentations, some of the noise. Could I get you to speak to what was really intrigued you to return to pre-hospital care?
So what really changed my mind was when I was working for a while in pre-hospital care, and I was thinking where to go on with my career. And then I started doing HEMS, and that really changed my point of view, because HEMS allowed me to see different systems. So just because you cover a wider area, you see different EMS systems, and the hem space I'm working is in the very northern part of Germany, and it's covering a part of Denmark. So I also experienced the Danish system. Well, I worked as a paramedic back then. I worked in the very south of Germany at the Austrian border. So I experienced the Austrian system, which is quite different. So seeing lots of different systems in prehospital care really changed my mind of how we perceive EMS in Germany and how others see it, and that really thrilled me. Also, when I started working operationally, so I decided working more in EMS, not just clinically, but operationally, I kind of looked behind the scenes and I understood problems I wasn't aware of before I did that. So yeah, that was another turning point, I guess. And I would say the ultimate turning point was working in the UK with London Hems, because I saw what kind of high level care one could provide, and not just only London Hems, it was also the APPs in London or in the UK. Um, And speaking of London Hems, they're really good, I'd say. And it's not just London Hems, it's all the other Hem service in the UK. And that's not because they're doing Reboa or thoracotomies. They do it every other week or so. It's because of a striking governance system and of the striking governance system we lack in Germany. And I think these are a few points where I think that really got me into the pre-hospital system.
So we will look at some of the challenges within Germany, but what I'd like to do initially is look at some of the successes actually, because it is a highly developed EMS system, ground-based system, and air-based HEM system. Could I get you to speak to some of the key factors contributing to its success in critical care delivery? I'll just pivot. I'll just pivot and just as an adjoiner say there is two prevailing HEMS systems that work in Germany, ADIETSE and DRF, and they really are the prevailing operators within Germany, operating to an extremely high level of care. But could I get you to speak to some of the sort of successes that contribute to the high level of care?
So if we actually, there are two more services. It's Jonita Air Rescue and something from the government as well. So we have four players, but two major players, ADSC and DRF. That's right. Both of them have around 30 bases or so. So, but what are the key factors? I think, especially in Germany, you have to go back in history a bit, because Germany was the first country to develop a structured nationwide EMS service in the late 60s and early 70s. And we were the first rescues, or the first nation who established HEMS, like not in a military setting, but in a civil setting. And we were the first to establish physicians on the street as well. So I think to understand what's going on in Germany right now, you have to be aware of this. And so we have a physician-based EMS service, quite on the contrary to other countries who are like paramedic-led. But we are very, very physician-based, meaning like on every major job, there will be a physician. And this is an advantage on one side, but also a disadvantage on the other side. It makes the system very expensive. And we have some sort of tribalism we see now, like physicians against paramedics. And we also see a development of paramedicine in Germany, or let's say of our paramedicine in Germany. And I think that's special in Germany, but that's something you really have to dig into, where the advantages are and where the disadvantages are. And I think our system is really expensive. It has really good points, but we have many points where we could improve, or where we have to improve, actually.
So before we pivot to challenges, actually, and we will just look at those shortly, Could I get you to speak to some of maybe the prevailing um, need you have in Germany? Me and you have very much spoken offline about upskilling or indeed raising the ceiling of care in within urgent care within the paramedic population and maybe using analogs that you've seen, like you said, in the UK from urgent care advanced paramedic practitioners. Could I get you to speak to some of these near-term pending needs and how they could be both developed and met?
So the thing is, in Germany, you can do training as a paramedic, and it's a 3-year training. I think it's quite similar to the UK standard paramedic. But then that's it. You can't really specialize in anything. So we don't have a you you don't study paramedicine or being a paramedic in Germany. There are some universities that offer non-clinical courses, but clinically, then you're done. You have your 3 years training. Right now, we do have a lack of urgent care services in Germany. We do have some sort of a GP service that does either telephone consultation or visits at home, but this field needs some sort of improvement. And from an EMS perspective, it's not reliable enough. So we have quite a big gap between critical care, where physicians are on the lead, and urgent care towards GP practice on the street. And in between that, there's a huge gap we need to fill. We do have some ideas in Germany how to fill this, but I think especially paramedics are trained for critical care. They're trained for maybe 5 to 10% of their jobs they're doing on, and the other maybe 95%, it's leading towards an urgent care kind of service. And we need to fill this gap. And I think that's the right way where we can implement urgent care APPs, because if you want to be really good in the system, it's not just a 3-year training or a 3-year paramedic training and then an additional 6 weeks course. It's a proper training and clinical training, maybe in a hospital, in ED, and also maybe with a GP, and do more work that we're doing now. And I think that would really improve the system and really help EMS, also the whole health sector.
Yeah, indeed, indeed. And, to your point about the 3-year training, which is now with fundamentally in the UK aligned with a Bachelor of Science, but with the Advanced Paramedic Practitioner Scheme, both in urgent and critical care, it's aligned to a Master's of Science. And that's also, I think, key where you're aligning education to practice, but you also, to your point as well, about having governance systems, breach back systems, but also governance systems which learn retrospectively from cases and case study. So there's multifactorial learning, I think, across the curve. Let's go there and talk about some of the challenges within EMS in Germany, Johannes. Could I get you to speak to maybe some of the prevailing challenges that you bump up against on a weekly or monthly basis, which really you are sort of currently working to overcome?
Yeah, that's a really good question. It's also quite a hard question because I bump into yeah, problems every day, I'd say. So I have the feeling that we in Germany, we have been resting on our laurels for a long time. I mean, to say that we have become quite comfortable in the situation we find ourselves in EMS. And I guess the lack of reforms and relevant further development over the last 20 years is now failing at our feet, falling at our feet. And I think the emergency world is changing rapidly, and especially we Germans are feeling the effects of this because we're using so many physicians per hospital. And I mean, increasing numbers of emergency calls, demographic change, lack of money, lack of staff, all this is like problems we're like facing, like everyone else. But in answer to your question, the most difficult thing is to make people see this, especially in Germany, and we need to be aware of, or I want to be aware of and convince people to to them knowing that we will never have as much money as we have now, and we will never have as many staff as we have now, and we will never again have as few emergency calls as we do now. So I think that's the key point. And especially decision makers need to be aware of that. And it's difficult to convince people that we have to look beyond our borders to see how other countries live and organize EMS. And I would, yeah, for example, let's look at the NHS. Aspects at the NHS are much better than ours. But there are also aspects of the NHS where I can only shake my head. I've seen people survive in the UK who die in Germany, but I've also seen people dying in the UK who survive here. So I think the NHS, for example, has been terribly underfunded for decades. So much so that it's on the brink of breaking apart from what I've seen. I mean, look at the EMS response times in bigger cities. We don't have this in Germany. But what I always say is that the people who work there, they're not stupid. On the contrary, they're brilliant people working in the NHS, and they have developed coping strategies to deal with exactly this shortage to keep the system up and running. And I think that's precisely what we need to look at, these coping strategies, because we are, like, first of all, we're the second most expensive healthcare system in the world, and that's not going to go on forever. And we need to look at your coping strategies to prepare and to look at solutions. And so long story short, we Germans, we tend to know it better a little bit than anyone else. And we have to force ourselves to look behind our nation's borders, and we have to be brutally honest to ourselves. And it's hard to convince people. Yeah, hard to convince people of that.
Could I just ask more of a personal question, actually, Johannes, and what that would be really around your work-life balance and workflow? Because, like you said, it's difficult maintaining competencies over multiple domains. So, being, a regular practicing clinician, albeit HEMS clinician and indeed HEMS doctor, versus, like you say, tackling some of these profound policy and system-based issues within EMS on a national level. Could I get you to speak to how you sort of balance the two?
That's actually hard sometimes, but on the other side, I'm quite lucky. So I work 50% operational. So I work for the EMS service in Hamburg, which is the second biggest city in Germany. So I do training there for paramedics, sometimes physicians as well. And the other 50% of my work is clinically, where I work in pre-hospital care and HEMS in a rapid response car. Sometimes it's hard to maintain both. So because especially the clinical work needs a lot of training, a lot of practice. And I'm lucky enough that my operational work somehow involves both. So that makes it work right now. I don't know if it works forever, but right now it does work. But on the other side, what makes it quite, let's say, demanding is the work beyond Hamburg's borders to do work to develop the system in itself, or working for professional bodies and stuff. And that's going on top, I'm afraid. And my family is sometimes rolling their eyes, let's say, because quite a lot of work. But I think it's worth it, and I think it's worth like putting the effort in right now.
Could I get you to speak to the advancement of technology within Germany and indeed how you're harnessing that? Because true to say, we are experiencing an exponential rise in technology adoption and how it's affecting practice. Could I get you to speak to really sort of how you see it playing a role within the future of prehospital critical care in Germany?
Yeah, so let's first of all say where we have a bit of a lack of technology, and that's digitation, and especially when we look towards our neighbors, Denmark or Scandinavia in total. And I think that's a huge part we need to dig into and develop stuff. I think the integration of EMS into a digital work from GP to hospital combined with critical care and sophisticated medical technology will play a crucial role in the future. And we do have, we're quite behind on that, I'd say. I also think AI will play a major role both in the control room and directly on scene. I think more in the control room. I think the ceiling is a bit high there to implement stuff. And I also think it's incredibly exciting to observe this development going on. And I'm really looking forward what the future holds. But also it's exciting what's happening clinically. For example, ECPR is becoming more and more present in not only Germany, but let's say a few days ago, the Netherlands announced that all HEMS helicopters will carry an ECMO device. So the whole country, the whole Dutch country is now covered with the possibility to provide ECPR. And if we look to Scandinavia, we see that CT scanners are getting smaller and smaller. In Scandinavia, they've experimented with carrying CT scanners in the helicopter. I think we're not quite there yet, but I think it's still like a little short view the future. And especially from when we look at Germany, we have developed quite a sophisticated system of tele-emergency medicine, tele-emergency physicians. And I think other countries really can look into this as well because they can really support a system excellently. But and last but not least, if you look at HEMS, we have development like drones and stuff that's are on the horizon. I don't know what time horizon we're talking, but all the major players in Germany looking at it right now, and we're facing issues with HEMS being available 100% of the time, and maybe drones will help this idea. So it's quite an exciting time to be in emergency medicine right now.
Could I get you to speak to, so this question really links in with telemedicine, and could I get you to speak to sort of the network effect really, Johannes? So the adage of having major trauma networks, stroke networks, heart attack or PCI networks, where there is a center of excellence of definitive care that these patients are brought to either through interfacility transfer IFTs or indeed primary bypass of secondary hospital straight to the defining hospital. Could I get you to speak to the adage of telemedicine in those circumstances where HEMS systems can really start to alert and have these MDTs, so multidisciplinary teams, approaches on scene?
So if you speak of multidisciplinary teams, you can have them either on scene or via telemedicine. I think a physician on scene makes a difference because you can more easily implement stuff that you gain in hospital, like experience you gain in hospital. So I think it does make a difference, and I see it every day on my work, especially with paramedics. So this is more of a handiwork where you need to have a physician on scene. But sometimes you need maybe just the idea or maybe the second opinion. You want to have some sort of callback, not just on the phone, but you want to have it properly. For example, looking at ECGs, for example, or decision making, whatsoever. And there telemedicine, tele-emergency medicine really comes into place. And when I look at some places in Germany who started off in 2008, so quite a long time, but it's the first experiences. And since more than 10 years, they are now up and running, and they can do amazing stuff. So they can link via video and, of course, audio into the ambulance, and they have a live view of the ECG and of the monitoring, and they can maybe not properly assess the patient, but they can properly talk to the crew on scene, and they can really help. So in areas where we use this, we can see that we can reduce physician response costs with maintaining the same high level of care. And also we can easily help people on secondary transfer, which in the future we will have more and more because we have a lack of staff. We will not have as many hospitals anymore in Germany as we have now. We have only let's say we are planning to establish proper networks. So we are facing the issue that our ambulance will be more and more away and will be more on the street and will do more secondary transfer. And telemedicine really can dig that into. And I think um, other countries have noticed that we developed this stuff and looking into it. And I think especially very rural areas, when I look into Canada or Australia or whatever, um, really can would I think they would really benefit from these experiences we're having in Germany right now.
Could I get you to speak to just the adage of aligning education to pre-hospital care, Johannes? So could you just speak to, whether there is an aligned Bachelor of Science or indeed Master of Science to projects, and also, so what we've seen within the UK is a real trend towards for prescribing, so that there's paramedic prescribing in the UK, but it's been aligned to the university, so they have to do a prescribing course which is run through some of the universities, so that there's some alignment with the pharmacological side of things, but also the empirical evidence, and then that's certainly the same alignment within Germany.
Oh, difficult to say right now. It's not properly on the horizon actually, but we are really working towards it. That we have there's something similar in Germany, and it's yeah. I think education plays a major role because when we are thinking of like reducing our physicians on the street, we need to transfer these skills and knowledge to someone else, and it's we're not quite there yet, but more and more universities have yeah paramedicine courses, but more operational, not clinical. And but we do, let's say, we are on the discussion to legalize this and at least start with a bachelor's degree in clinical paramedicine. And I would really hope that it works out. And unfortunately, after the collapse of our government, we were just this close to implement a law. And I hope once we're going to have elections in February, and I hope, very much hope that we can start off where we ended a few weeks back. And yeah, education is important, especially we have to do it together, physicians and paramedics together. And I think that's where we really improve. And that's something I'm really yeah, sometimes struggling. I go to a training and it's a training for physicians. And then I'm sitting there in a room with 20 other physicians and I simulate a job and I step into the role of a paramedic. It's nice to have this switch of change of view on the job, but we should train as we fight and we should train together. And that's something we really need to improve in Germany. And I hope if we establish a more yeah, sophisticated education for paramedics, then I think we can get there close as well.
Yeah, absolutely. And I think that's powerful. And it'd be nice to just expand on that actually and double click on that, Johannes, and just ask you about the role of interprofessional learning. So Craig Webster et al. 2024, so I'll put the paper in the show notes, really showed the adage of interprofessional learning through non-informal learning. And that's not just within pre-hospital care, that might be from rehabilitation through to surgical care, through to emergency care. But, the role of physicians and indeed allied health professionals such as paramedics, physios, occupational therapists, and otherwise pharmacists in these interprofessional teams. There's a lot of vicarious learning that occurs in proximity. So even from, like you said, from governance, dissecting cases, understanding decision making, understanding patient outcome, what were some of the evidence-based medicine approaches, what worked, what didn't work, And it's almost this transferal of information and of learning seems to be huge leverage across interprofessional teams. Could I get you to speak to that?
I think the key point is understanding decision making and understanding different approaches. Because when I come from a background as a physician, so my background is mainly the hospital, let's say, within the last 10 years or so. So I certainly go and will see differently into a job than a paramedic who did his training is only working pre-hospital. So this guy might have a very technical point of view, and I might have a very brainy point of view in terms of what medication or whatsoever. So, and my experiences, we can really learn from each other if we really do understand our process of decision making. And I really love to, when I'm on scene, I get a handover from a paramedic and I say like, okay, you go on doing your job. And I just stand back and I just watch like I would watch in a simulation when I do a training. And if you can make the step back, you see a whole different world of perceiving pre-hospital care. And I really experienced this in with London HEMS because we there worked in a three-person team, so two doctors in a paramedic. So one of the doctors always could step back a little bit and just look into, and that really helped for debriefs, and that's what we see in our training and in our simulation trainings, especially when we do it interprofessionally or interdisciplinary. And the discussion is totally different when there are other disciplines involved. Also, when there are disciplines involved, nothing to do with EMS or nothing to do with emergency services. For example, you have a psychologist just watching the training and talking about CRM stuff afterwards. That's a whole new way of perceiving things, and I think that's the really key point to set up a proper critical care team and a specialized team. It can only work interdisciplinary, I would say.
So just looking at some of the, as we start to come into land, Johannes, on the conversation, could I get you to speak to some of the trends and or developments in pre-hospital care that you're most excited about within the future of EMS in Germany?
Now, I believe that pre-hospital critical care is the fastest, or maybe EMS in total. It's the fastest and most comprehensively changing area in medicine. I really do think so. And whether we like it or not, we feel the challenging facing our society most quickly in EMS or critical care, pre-hospital care. And what drives me is not only to accompany this change, but also to actively help and shape it. And that's that's what I'm most excited about. And well, by this I mean, in particular, finding solution to organizational or operational questions, and above all, improving patient care and making patient care safer. Yeah, that's the thing I really enjoy.
Yeah, indeed, indeed. And actually, it was really useful just talking to you the other day and getting an appreciation for where you see the leverage and the gaps within Germany and also how you see, like you said, an upskilling of a whole population of clinicians to benefit the public. And I think fundamentally it is about benefiting the patient and bringing added benefit through education, through training, and through received wisdom of a multitude of clinicians actually. So I think it's a really exciting time in Germany actually, and it seems to be almost a tipping point in various ways. So just finally, as we come into land, Johannes, could I just get you to speak to um if you had a wish list and if there is something you could change within pre-hospital medicine today in Germany, what would it be for you and indeed why?
That's a difficult question. There's so many things on my wish list. But if I would only have one wish, so let's say put patient care and safe patient care in the center, I would probably establish a proper governance system first in HEMS and then in EMS in total, because I think that would really help us to look at ourselves and to really, I said we need to be brutally honest in the beginning, and that would really help us being brutally honest and understanding what we're doing and where we are facing issues and stuff. But if I could make a second change, I would implement a master's degree in paramedicine. Yeah, that's the two things.
Listen, that's fantastic. And to your point earlier, just as we come into land, and I think there is real adage in this, stepping away from your own system, seeing other systems, because as you say, you brought so much learning back from working in London and also working as for other systems, whereby you can see how things are done differently and then bring the added benefits back to Germany. Those would be two powerful changes, absolutely, and it would
Yeah.
be fantastic to see that. Johannes, listen, I'm going to stay in touch with you over this period of time, and we'll touch base with you again on the podcast actually to see how things are going over a period of time. But listen, thank you for your time today. It's great to get your on the ground thoughts, experience, and reflections, and also from a strategic level as well. So thank you.
Yeah, perfect. Thank you for having me on the podcast. And I only can encourage everyone to also look at the German system, the problems we're facing, and talk to us, look at the physician-based system and see the differences.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.